Welcome to the Wake Up Protocol. I am your host, Nadja Haldimann, and together we're having life-changing conversations with real people about spiritual awakening and the transformations that follow. We're mapping the messy path of awakening so you can go further faster and feel a little less alone along the way. For this episode of the Wake Up Protocol, I'm joined by Tracie Bell, a designer, photographer, mystic, writer, and author of the forthcoming travel memoir, When Your Mother Calls You Home. Tracie's story is unlike any I've ever heard before. It begins with a profound near-death experience that cracked her wide open. It didn't just show her how fragile life can be, but it showed her the vastness of what exists beyond life. In that moment between worlds, she encountered unconditional love, infinite knowing, and the deep realization that her soul had more work to do in this lifetime. But her awakening didn't end there. It was just the beginning of a lifelong journey through grief, psychic openings, ancestral healing, and creative devotion. In this conversation, Tracie shares how her time on the other side has shaped the way she lives now, rooted in presence, guided by synchronicity, and deeply attuned to the unseen. We talk about her mystical gifts, the wisdom that lives inside nature and the body, and what it means to come home, not just to a place, but to your own soul. This episode is a remembrance of your light, of your path, of the deep sacred knowing that lives inside you. I hope you feel the beauty of this one as much as I did.
When I went into this tunnel, it was like this long tunnel with columns, and it was lined with people that I knew in this lifetime that had passed on before me, just welcoming me in, guiding me towards this very bright light at the end of the tunnel. And I felt such warmth and welcome. I was pain-free, but that was the first thing. When I was out of my body, the pain was gone. But in this tunnel, I just felt welcome and loved. And then when I moved into the light, I don't know how to ever explain this to help anyone understand what it's like when you're not in physical form anymore, but to be in that light was to be in the presence of God, to know everything all at once. There's no time or physical or pain or suffering. There is just love and knowing and belonging. And I felt home.
Tracie Bell, welcome to the Wake Up Protocol.
Hi, Nadja. Thank you for having me.
It's so lovely to have this conversation with you today. We met a few months ago in a little mountain town where you live here in Washington State. And we talked about spiritual awakening and this podcast that I was just starting. And your story was just so incredible. So here we are today, and I can't wait to see where this conversation goes. We also just realized this morning that there is a big synchronicity that's happened today, 2 years ago and 24 years ago. We're definitely going to get into that in a minute. But before we start, I am curious, what's alive for you right now in the world and in your heart?
Well, my life has been very small for the past year. I've been writing a book. I just finished a book. So that's been a very solitary practice. And maybe that's another synchronicity, is that one of the things that I discuss in the book is my near-death experience coming full circle. I wrote a travel memoir, and I spent 2 months in India. And during my time in India along the Ganga River, my near-death experience came up, and I realized I just never really processed some of the grief around my near-death experience, because it wasn't just that I had a near-death experience, I also lost a baby. So I just finished the writing of that book. It's getting ready to go to beta readers right now and looking to publish, release date of November 1st. So my life has been very small in this little tiny mountain town of 2,000, writing a book and working.
Yeah, thanks for sharing that. Yeah, you went through a lot 24 years ago, and I can't even imagine what it must be like to almost die and lose a child at the same time, and then somehow finding your way back to where you are today. And I really want to congratulate you for writing this book and
Thank you.
getting it to the finish line right now. That's very exciting, and I can't wait for you to publish it and for the world, including myself, to be able to read it.
Thank you.
Yeah, so I do want to talk just for a minute about the synchronicity that happened today. And we just both realized this morning when we texted each other.
Yeah, that's just the strangest synchronicity. I looked at the calendar when you said that, and I realized today, it was 24 years ago today that I woke up for the first time from my coma. They put me back under. There's a period of time where they put me back under an induced coma. But today I woke up 24 years ago.
Incredible.
And I didn't even think about that when we were looking for dates that worked for the both of us, or
yeah, and we scheduled them out so far in advance. So you literally woke up and here you are telling your story on the WakeUp Protocol. And I got rushed into surgery exactly 2 years ago. And I was at this exact moment in surgery 2 years ago. So, and that's really where this work that I'm putting into the world right now got started, because when you're facing death, all of a sudden life has complete different meaning. So I would like to start by having you tell me a little bit about how you would define spiritual awakening before we go deeper into your story.
Spiritual awakening for me, I think there's a before and after moment where something happens that's so jarring that you examine your life, and there's a before and after moment in your life. I would say that I've had 3 of these moments. Actually, my near-death experience was the first of them. And suddenly I had, with my near-death experience, this before and after lens in my life. And I knew that I was able to see that life was fragile. I could be gone at any moment. And I needed to make choices every day to embrace life, to embrace the moments that I have, the wonder of it all. And I think before my near-death experience, I was a little asleep at the wheel. I was very motivated by work and projects and doing and achieving. And when my near-death experience happened, and I had what I would call the first spiritual awakening, was the recognition that my time here is limited. And there was definitely a moment in my near-death experience when I was on the other side that I understood I was meant to be here, that I had work to do. So I would say that spiritual awakening is an awareness. My first layer unfolded of awareness. I have limited time. I have things to do. I need to make really good choices with the time that I have left. So it was that first macro level unfolding. I've had 2 adjustments since then. We can get into that.
Yeah, I would definitely love to hear about that. So you say it's an awareness that time is limited. When I hear that, I feel like there is this idea that we think life is limitless, that we will live forever. And then something happens and all of a sudden we realize life is finite. And that awareness changed something for you. What did that change for you?
There's 2 layers to it. One, I think that in our human experience, we think of our time here as being unlimited. And what happened when I had my near-death experience is I realized time is actually unlimited on the other side of this. But during this time, while I'm here on Earth, embodied in this human form, I have a limited time to evolve. I have a limited time to be here and accomplish what I need to accomplish for my soul's growth. One of the changes in my own awareness was recognizing the energy of everything, recognizing that the energy that animates my body is the same energy that runs through all life, recognizing that time is perhaps an illusion, that there is a limitless experience outside of the human form.
Hmm. Okay, so you actually got the realization that there is no limit, that we are going on forever. And yet in this incarnation, we get to choose what we're going to do with our lives. And it sounds like your near-death experience was a real pivotal moment where that became really clear to you. I'm curious what that looked like, your experience that you had. Would you like to go into the story of that?
Of course, my near-death experience.
Mm-hmm.
Yeah. So 2001, I was 5 months pregnant with what would have been my second child. And I had an 18-month-old son. So in my 20s, I had a really difficult time with reproductive problems. And I had developed a reproductive cancer, clear cell adenocarcinoma, which was related to my mother being given a drug when she was pregnant with me called DES. So I had many surgeries and many complications with my reproductive system. And pregnancy was very difficult for me. I saw many doctors hoping to conceive and preserve my fertility because the option was that if I didn't get pregnant and have a child, that I needed to have a hysterectomy to prevent cancer. So I chose to try to have a child. And so I think it was around 20. Yeah, I was 29 when I conceived my son with the help of doctors, with the help of fertility specialists. And I was a high-risk pregnancy. And so I spent many months on bed rest with him. When he was a year old, I got pregnant unexpectedly, not trying. And I was ecstatic because I thought, wow, I'm going to get to do this again. You know, I love being a mother. It was the most joyful experience of my life, giving birth to him, having him in my life every day. And so when he was 18 months old, I was 5 months pregnant. We went on a vacation, our family, to Florida. And just before we left for that trip, I saw my high-risk OB and made sure everything was fine and everything looked great. We found out we were having a little girl and left for the vacation, the three of us, my husband at the time and our son. And a week into the trip, I started to feel ill and started to have some spotting, cramping, running a fever. Went to a hospital and they misdiagnosed what was going on. They said, oh, it's nothing to worry about. It's probably a urinary tract infection. So went on to enjoy the vacation, but I was feeling worse each day. Even though I was on antibiotics, I was feeling worse. And I think it was the third day, my temperature spiked really high, the cramping got worse, and my water broke. So my husband called my high-risk OB, who was in Ohio, and said, I think she's in labor. And he said, find out where the nearest hospital is with an OB floor, go there, go straight to the floor and tell the attending physician to call me. So we called 411, which was information at the time, you know, that we didn't have Google then. This was a little while ago. Called 411 and they said the nearest hospital for us was Bon Secours St. Joseph in Port Charlotte. And we were in an area near Bradenton, Florida. That would have been a 45-minute trip for us. So we loaded the family in the car and made the drive. And I was getting worse along the way. My fever when we arrived was at 105. And they put me straight into a room with cooling blankets, and they were trying to figure things out with my doctor. And I was in and out of consciousness at the time. I didn't know what was happening. I would later find out that I had a condition called placenta previa, where I wasn't able to miscarry. And the placenta had pulled away from the uterine wall, and I had gotten an infection. And that infection caused me to go septic. So the condition that I had was sepsis. And my temperature continued to climb. My pulse was weakening. And the next thing I remember was people were very busy doing things. They put a cooling blanket over me, which was freezing, and I was shivering violently. And there was a man to my right who was in a jumpsuit, like a pilot's jumpsuit. And I remember him checking, holding my wrist and saying, you know, we can't take her. She won't make the trip. And that was life flight. They were going to fly me to another hospital because I ended up at a hospital that was really like a geriatric hospital. They weren't used to having young patients that were pregnant at this hospital. So things got very busy from that point on, and I was in and out of consciousness and my pain was increasing. And I remember being in sort of the labor process, like they were trying to encourage me to push. I believe the doctor said, we have to evacuate the uterus. They knew that I was dying. So they took me to an OR, and I don't remember a lot. I remember grabbing the nurse's arm that was pushing the gurney and saying to her, please put me out of my misery. Could you just put me out of my misery? Because the pain was so great in my body. And it's hard to explain that kind of pain unless you've had it. But what happens with sepsis is your organs start shutting down in your body systemically. So my heart was erratic, my lungs were filling with fluid, and I began to bleed out. So the next thing I remember is being in this tremendous amount of pain and then suddenly hearing this whooshing sound. And then I was above my body, looking down on the scene. I was watching people tending to me, trying to save 2 lives. And then I heard this whooshing sound. I was above and looking down, and then I was pulled into this long tunnel, which I would later understand as people call it the bardo, or the in-between, because I wanted to understand my experience better. But when I went into this tunnel, it was like this long tunnel with columns, and it was lined with people that I knew in this lifetime that had passed on before me, just welcoming me in. Wow. Come in. Welcome, like my uncle, a former neighbor, and guiding me towards this very bright light at the end of the tunnel. And I felt such like warmth and welcome. I was pain-free, but that was the first thing. When I was out of my body, the pain was gone. But in this tunnel, I just felt welcome and loved. And then when I moved into the light, I don't know how to ever explain this to help anyone understand what it's like when you're not in physical form anymore. But to be in that light was to be in the presence of God, to know everything all at once. There's no time or physical or pain or suffering. There is just love and knowing and belonging. And I felt home. I think that sense of feeling home and loved that I had wanted my entire life, wanted to create for my son, I was feeling in that space. So I understood that I had to go back, that I had things to do, that I was meant to do here. But I didn't want to go back. I didn't want to come back here. I remember no, I don't want to go back. But it wasn't my time. Yeah. So back through the tunnel I went, and I was briefly over a scene of a doctor in an office, and he had his head in his hands. He was on the phone with one phone in one hand and head resting in the other. And he was explaining, I don't know what to do. I can't regulate her heart. Nothing is making sense to me right now, why I can't stabilize her heart. And then I felt that familiar pull and whoosh and was back in my body, but then nothing. I don't have a memory for a while. I remember regaining some consciousness and thinking I was in a coffin underwater. This is not going to make sense to anybody, but it made sense to my mind because my eyes were swollen shut and I couldn't see. So everything was dark, but all I could hear were these watery dripping sounds and gurgling. And I felt that I was in a small space, but I felt like I must be underwater because I felt like I had scuba gear in my mouth. I'm breathing through a tube. I'm breathing through a tube. I must be underwater. So my mind had made these stories about what was happening. So apparently it was on this day, 24 years ago, that I woke up and I started to gain consciousness and felt something in my mouth. And my instinct was to pull it out. I pulled out the respirator, which set off a bunch of alarms. And I had a feeding tube. I was on a respirator. I had a pacemaker because while I was sick and out, I experienced pulmonary effusion, which is where my lungs filled up with fluid. I flatlined and died. So I had a pacemaker to regulate my heart. I had a machine breathing for me, and I was being fed through a tube. But when I woke up and I was confused, I pulled that out, those tubes out of my throat, which set off alarms. And then everybody came into my room. I could hear multiple people around me. I still couldn't see. And then I was sedated, and they reintubated me, and they tied me down to the bed so that I wouldn't be able to do that again. So I really didn't fully gain consciousness for another 4 days. And on the 4th day, they lowered the amount of medications they had me on, the sedatives, and they took me off the ventilator. And let me back up a little bit, because I did have moments of consciousness before the ventilator was off. There was a nurse, her name was Gigi, and I didn't have any way to communicate or let people know that I could hear them. And my hands were tied down. But I remember when Gigi was in the room moving around the bed, she would talk to me, and I tried to get her attention by moving my hand. And so by doing that, I would make a motion like I was writing with my right hand. It was strapped to the bed. Mm-hmm. And this was during that period where they were purposely sedating me, but they were bringing me up just a little bit each day. Mm-hmm. So they would lower the drugs to bring me into a more conscious state. And during one of those times, I made that motion like I was writing. And she said, "Are you trying to tell me you want to write?" Mm-hmm. And so I exaggerated the hand motion even more, like, yes, I want to say something. So I started writing. She put a piece of paper on my stomach, untied my hand, and placed a pen in my hand and put it on the paper. And I started writing. When I see those messages today, the writing is so tiny. It's the tiniest thing. And I'm misspelling things. Like I wrote baby, Baybee, which doesn't make any sense. But I was asking over and over, can I see my baby? When can I see my baby? I want to see my baby. I don't know if I was asking to see my son, who was a baby, he was 18 months old, or if I was asking to see the baby thinking I had just given birth. Mm-hmm. I don't know the answer to this day. But she said, "You're asking to see your baby." She was acknowledging she could read what I was writing. Mm-hmm. So I began communicating by writing these notes. And I filled this page. They're all over the place, with notes. I couldn't see what I was writing because I was on my back, but I can see those notes now today. So my family understood, with the help of a grief counselor that was at the hospital, that I needed some closure. The grief counselor at the hospital said, "We need to make sure she understands that she lost the baby. We're going to need to have," basically they recommended having a funeral so that I understood I had lost the baby. Because if I didn't have that kind of conscious experience, that years down the line, I might see a young girl at a park and think that it was my daughter. Mm-hmm. That I might think that she was out there. And so my family said, "We don't want that to happen. We don't want her to suffer. So we should do this." So they brought in a priest. And this is the day that I was fully awake and off the ventilator. Or maybe I was still on the ventilator at this point. I was. So I was still on the respirator, but they brought the baby in. And I didn't understand I had lost the baby. Mm-hmm. So I had this traumatic reaction to seeing a child that was lifeless in my arms. They placed the baby in my arms so that I could see her. And I started to choke and cry because I was horrified, because I wasn't expecting that I lost my baby. I thought that I had given birth. Nothing had really been clear through that experience. But in that moment, it was clear. I'm not sure who it was, but somebody that was to my left leaned in and said, "If you get upset, we have to take the baby away." And if you cry, we'll have to take the baby away, because it was causing me to choke. And I know that no one in that moment intended to traumatize me at all. I know no one meant to harm me. But in that moment, I stuffed down this sort of traumatic experience. Don't cry. Don't express myself. I was in horror. I had just come in back into the world. This was like my first experience waking up, right? Like, I had been in this peaceful, amazing place where everything was perfect. And I was back in this experience in the body of pain and suffering and heartbreak. And I had a long recovery ahead of me after that. So I was in the ICU for a few more days after that before I got moved to a rehabilitation floor. And I had to learn to walk. When you have an experience like that and your body goes through that kind of shutdown, you have some atrophy in your body. So I had to learn to walk. I had to have the pacemaker removed. They had to see if I could have it removed. I had multiple blood transfusions because I lost a lot of blood. My recovery took about 9 months. And closer to the 9-month period where I was going through this healing, I had some vocal cord damage. I had some cognitive problems with memory, short-term memory specifically from the oxygen deprivation. But I started to have panic attacks. I started to have depression. And the whole experience didn't fully make sense to me because I had died and understood that there is this glorious life beyond, but I came right back into pain and suffering and was traumatized. So what ended up happening is with these panic attacks and this depression I was feeling, I got this amazing doctor, Dr. Lawrence Needleman in Columbus, Ohio, and he practiced cognitive behavioral therapy. And he introduced me to some incredible concepts that really helped me with PTSD, post-traumatic stress disorder, which was my diagnosis at the time. And he helped me within 12 sessions recover that memory of holding my baby, which I had blocked out. So after that happened, I blocked it out of my mind. The panic attacks were happening and the depression was happening because my mind remembered what happened, but it kind of sectioned it off. So once I had that memory and recovered it, my panic attacks stopped and my quality of life improved. And that is when I fully stepped into ease and was like, I want to be alive. I want to do everything I can do. I want to make things in the world. I just was alive. I mean, alive. My son and I were inseparable. I have accomplished so much in the last 21 years that I think it's like 3 lifetimes. I don't even know how I've accomplished the things that I have accomplished out of just a love for this life, out of a love for the experience of being here. I've had heartbreak since then, and I have grown even more. I've had experiences since this near-death experience, and I've grown, and more has unfolded. I think you and I talked about that the night that we met, that my near-death experience just started a blooming process, and it's constantly unfolding for me.
Oh my goodness, Tracie, what a story that you have to tell, and how rare that you get to tell that story. So many people do not get to tell that story. We've all heard about near-death experiences and going to that beautiful place of love and light where everything is perfect, and then coming back for whatever reason your soul chose to do in this lifetime, and then having to go through this incredible grief as the very first thing coming out of that. You were in a coma, I assume, right? Is that what it's called? Yeah. The first experience, just realizing death is right there in front of your eyes, and not even being allowed to acknowledge it in that moment, and having so many angels around you in this medical system that were able to help you, including the nurse. What an incredible human being that she was so dialed in that she was able to connect with you. I have so many questions. I'm always thinking about when somebody is in a coma, and also with the podcast Telepathy Tapes, what we're hearing about autistic children, how they're inside, but they lack the ability to communicate in a physical way because they're just in a different dimension, in a different frequency, and how they're starting to be able to communicate. I'm wondering, when you were in that coma, and you probably don't have too many memories from that time because you were so heavily sedated, but you said you were like in an underwater coffin. That's how you described it. Do you remember having any awarenesses in that time and wanting to communicate and not being able to, or what was that like?
I do. So during the time that I was in the coma, and there were moments that I had awareness. So I could hear people in my room speaking at times. I remember my husband at the time, he would put headphones over my ears and play music. And I remember how grateful I was for music. And I don't know why, the only song I remember, and I remember it playing so many times, even though I know that it was a full playlist, was the Beach Boys' God Only Knows, was playing like multiple times. And to this day, I can't listen to that song without feeling overwhelmed by this emotion, which is more about gratitude for these beautiful things that we have in life, these little soundtracks to our life, or musicians and art. I get very moved. I remember that. And I definitely remember the kindness of my nurses, specifically Gigi, and there was a nurse, Sharon. Sharon recognized after, when I pulled the respirator out and they intubated me, I was really struggling with some choking. And she leaned into my ear and she said, "Honey, it's best that you don't fight it. Just let it do the breathing for you." She said, "I know about this because I was on life support once too."
Wow.
And it made all the difference. I just surrendered. She had this sweetness and just leaned in so close and said it so quietly, but I just surrendered and let the machine do the breathing for me. And that let me relax. So there were these little moments. I don't even know when she said that, if she knew that I could hear her or I was conscious, but I remember her saying it. And I remember that allowing me to just let the machine do its work. I really just felt like I was in a box underwater. I really didn't know what was happening or have a point of reference for what was happening.
I find it really helpful to hear that there were moments when people got through to you through the music and then afterwards with that nurse. Because I'm always thinking, if somebody in my life was in a situation like that, what would I do? What could I do? How could I try to get through to them in a time when they might not necessarily have any means to communicate? So, yeah, thank you for sharing that. You also talked about this brief moment where you went into your doctor's office, even though you were physically in surgery, I think, at that point. Can you tell me what that was like? And did you ever talk to that doctor about that afterwards?
I'm glad you brought this up because it didn't register with me until I was on a recovery floor. Several of the doctors came to see me because I was a miracle. I really had less than a 10% chance of living. And I want to tell you this part of the story because this is the miraculous part. This is how I absolutely know I'm meant to be here. The doctor that I saw in his office, his name was Dr. Sergio Cosu. He was a cardiologist. And he came in my room to see me before I was leaving to go home. And I said, "Oh, I met you once before. I saw you in your office on the phone. You were talking about you couldn't stabilize my heart." And he said, "No, that's not possible. My office was down the hall." I was like, it wasn't possible. We both were like, "What happened?" We were trying to understand how I could have seen this conversation. He acknowledged that the conversation happened. And he acknowledged that he was on the phone having the conversation, but there's no way I could have seen or heard it. And there was a little synchronicity there. He had done his residency at Ohio State University, which was in my town where I lived. So that was very sweet. But the miraculous thing is that originally when I started telling you the story, I told you that we called 411 and they sent us to the nearest hospital, which was Bon Secours St. Joseph in Port Charlotte. It turns out that was not the nearest hospital to us. But it was the only hospital where there was a doctor who had just been to a conference at Vanderbilt University where they were studying a drug. It didn't even have a name yet. It was under study. On my IV, it just said X. But he told my husband, I was just at Vanderbilt University and they're studying this drug. It's specifically for people who have sepsis. It protects the organs and keeps the body from shutting everything down. And I think because your wife has really little chances of surviving this, that we could get this drug on a compassion basis from Vanderbilt University. So my husband and this doctor, Dr. Mark Asparilla, who saved my life, they filled out a stack of paperwork that was like an inch thick, sent it to Vanderbilt University, and Vanderbilt gave me the drug on a compassion basis.
Wow.
And it saved my life. As soon as I was given that drug, I started to make a turnaround. My numbers started to improve. I think that drug is now called Zygris. I believe I was the last person studied on the drug, I was told. Then they got approval. But it did save my life. And if I hadn't gone to the hospital I was at, it wasn't the closest to me. It was the one 411 sent me to. If I hadn't been there, I wouldn't have been under the care of the infectious disease doctor there, Mark Asparilla, who had just been at the conference the week prior.
Wow. What an incredible synchronicity.
That was a potent one. That, and I think the most important was that the doctor that was on call, that was the attending physician for the OB floor, was Dr. Anthony Brignoni. And he was young, and I think he was very terrified. I don't think he'd ever had a young patient, and he was afraid to lose me. And because of that, because of his humility, he did everything he could. He called experts and had a team. And I was in the right place at the right time. And I think about that often. And I think about what a gift it is to have been given more time here with my son, especially, even though it wasn't meant to be that I would be here with my daughter. I have had 24 years more with my son and have had the spirit to make a life that's magical. In these 24 years.
Yeah, beautiful.
Yeah.
What a blessing that that all the stars aligned for you to be here. And there must be a reason why you are here. And I'm glad you're writing this book right now and sharing things with people and helping them see another way. You told me when we talked a few months ago that sometimes you now have access to psychic messages. I'm curious if you would want to share something about that.
For sure. I've been a closeted psychic. We'll use the word psychic, although it's not my favorite. Intuitive maybe is my favorite word to describe my abilities. But I had really powerful intuition and precognition and clairvoyance, all the clairs when I was young. But I grew up in a very religious household, and my mom, while she never did anything to discourage me from speaking about it, it was definitely clear that we shouldn't talk about it outside of the home. So I didn't. And so I was a closeted intuitive my whole life. But it was after my near-death experience that I was always in both worlds at once. I could sense into greater themes and the bigger picture, and not just for me, but for others. So often when people would come to me, like a friend who was seeking counsel, I didn't tell them, but I could see like a greater path for their life and what they were meant to do. And so I would just work it into conversation with them. Or I got signs regularly. I felt very attuned with the earth. I had some big adjustments after my near-death experience with that. Especially with nature. I became very attuned with nature. The animals started coming to my home regularly. At one point, I was living in the city. My family had moved to this little house along the edge of the woods, and deer were just coming to the house regularly. At one point, there were 17 and 19 deer on the lawn. of this little house in the suburbs. And that was the beginning. And that led me on a path of really wanting to understand what was at work there. So I found Indigenous teachers to study with. My near-death experience opened up many magical pathways. And I would say that there is an intuitive component with clairs, like clairvoyance, clairaudience, clairsentience. There's a nature component for me. And there is definitely a spirituality that I have that is quite different than before my near-death experience. My experience with spirituality was going to church, and I spent a lot of time in church as a young woman and in the Catholic Church up until my near-death experience. But now I have a completely different view on spirituality. I don't look for it outside of myself. It's definitely a personal practice. I often go to that place within and tap into that light and sit there for a moment to recalibrate. That's one of the things that I recognize, is that I can constantly come back to that moment in the light and reground in it. Even in dark times, which I've had dark times since then. I've had 2 experiences that were really difficult to navigate in my life, big changes and turmoil, but coming back to that presence makes all the difference for me. And I believe in that meditative state is accessible to everyone. It's free.
So that meditative state, that state of presence, you also described what it looked like when you were in that place of love and light. Is that the same place, or is it different?
It's the same. It's just complete oneness. And it's so bright, like being in the sun. And it's a place of complete peace and love. And I believe love is actually the energy that runs through everything. I think that's the highest form of energy there is.
Yeah. Well, have you been able to use your psychic gifts with other people by helping them through situations, or how are you using that in your life?
I have. This is something that I've only just discussed in the writing of my book. I have not done it professionally. I serve as a vessel. That's my practice. If I am with someone and information starts coming to me that's meant to be shared, I will ask permission to share it. But it's not something I've ever been comfortable with. I've just never been comfortable with being psychic. So I'm learning to be comfortable with sharing this gift, because it's not something that is mine. I mean, it is mine, but it comes from a higher place. I've used it in a way that you would call mediumship. Often it's guides coming through with information for other people. And when a guide does come through with information for someone else, I just pass that along. And it's almost always meant to help someone evolve on their journey. In the book, I share one of the experiences that I had. It's my favorite because it's someone that I love so much, a friend of mine. And it was the first time that someone was coming through really clear and loud. And I didn't want to share because I didn't want to tell my friend I'm psychic. I didn't want to tell her. We were new friends and I didn't want to out myself. We were hiking and I saw this woman over her shoulder, this elderly woman. And I was getting very clear message from this woman. And I said to my friend, how do you feel about mediumship? And she said, do you mean like psychics? And I said, yeah, like psychics. She was like, I don't know. I guess I don't think about it so much. And I said, well, would you like a message? And she said, you mean like from you? And I said, yeah, there's someone here that has a message for you. And she said, okay. It was really awkward because it was like a new friendship and I really liked her. So she said yes. And I said, well, there's a woman here who says she's your grandmother. Her name is Franny. And she said, you're really struggling right now. And she's encouraging you to bake because she said that's going to teach you to manage failures, to be able to work through these feelings of failures or to move forward. And she says, maybe you're drinking a little too much, So all this information was coming in and I just passed it on. But then the most defeating thing happened. My friend, who I loved hanging out with so much, looked at me and she said, I don't have a grandmother named Franny. And I was like, oh, well, okay. Well, I trusted it. I passed it on. I'm sorry. I felt like super awkward, like I shouldn't have said anything. Maybe I've ruined this new friendship. 3 days later, I got a text message from her at night, like closer to bedtime, 9 o'clock. She said, can I call you right now? And I was, yeah, sure. She called me to tell me that her daughter had been working on their ancestry.com family tree. Mm-hmm. And she found that her grandmother that she never met was named Franny. Fran went by Franny, and that there were photos of her. And the photos of her described her as being older, little round glasses, hair in a bun, floral print dress, probably like 1940s. She said the photos of her on Ancestry that are there look exactly like I described her. Can I show you? Can I send you a picture? So she showed me, and there was a mention in these newspaper articles that she was an award-winning baker. And so this was when I was first getting comfortable sharing with other people my abilities. And at first it was a crushing experience, but days later, I felt so like, oh, thank goodness that it all worked out. And now it's still not something that I do professionally, but when spirit works through me, I allow it.
Beautiful story. And I'm so glad that her daughter ended up doing that ancestry just a few days afterwards so you could be validated. Yeah. I've heard that from a few people that when they have a near-death and out-of-body experience that they start getting psychic. I wish it's something that I had. I had a near-death experience, but not a out-of-body experience. And yeah, who knows? Maybe there's something there if I start paying attention, but at this point it's not here. And I just find it so beautiful that people like you have access to that. And I wish you luck and many blessings on that journey of seeing what you're going to do with those gifts and how you're going to help people with those gifts.
Thank you.
Yeah.
I think everyone has the ability to have these gifts. I think that's in my time in the light. One of the things that I recognize is that everything is available to you, our thoughts, our energy. You just know everything. You have answers to every question. And I think what happens in moments like that is if someone is a little off track in their life or their purpose, and then one of their angels, their guides, whatever you want to call them, is coming through to say, hey, I need help getting this message through to get them back on their path. And when I agree to be a vessel for that message, I'm really just allowing that all-knowing to come through, that information to flow through. I feel like an extension cord in that moment between the person that's here and the information that exists on the other side.
So beautiful. Yeah. And I absolutely believe that we all have access to that. And the longer I'm doing this podcast and the more people I talk with, it's becoming really clear to me that this place that you described of love and light and where there is no future and no past, there's just that present moment, that exists. And there's just a veil that has to lift in order for us to see that. And it's probably also a good thing that there's a veil, because if we were always in it, we might not be able to be in this incarnation. And I believe there's probably a reason why we chose to be incarnated in these bodies in this time without the veil being too open, so that we can do our soul growth before we go back to source. Yeah. So you have recently finished writing your book. It's going to be published soon. How can people find you?
I just launched a website. It's tracieball.com, TraciebAll. traciebell.com. And the book is called When Your Mother Calls You Home. And it's a travel memoir. And I do share many of my healing experiences with Indigenous healers, energy work, yoga, my own path. Because for me, it's not just my near-death experience. I've been constantly healing since that experience, healing old patterns in my life, ancestral patterns in my life. It's a constant tending to the soil. There's a constant tending to the soil that happens when you have an experience like this.
Yeah. I had a guest the other day and he called it healing and holing, how to become whole again. And it's a lifelong journey, lifelong path. And that's what I'm hearing from a lot of people. It's not that we're broken. It's just we get to step more and more into our purpose, into our truth, into our authenticity, and really become the sovereign beings that we're all meant to be in this time.
Absolutely.
We're coming to the end of this conversation, and I have one final question for you. If you could go back in time and give a message to a younger version of you, what would you tell her?
I think about this question a lot, and I think about it more from a philosophical perspective, because my life has been beautiful in the moments I didn't know the answers. So rather than give my younger self any information or advice, I think I would just say, in those moments when it's really dark, all that you need is the smallest amount of faith and you'll get through it. That has been a theme in my life. A very important practice is never letting the light of hope go out, never letting the light of love go out. So tending to that little tiny flame, just keeping it there. Yeah, I wouldn't give my younger self any advice or make any different decisions other than that.
Beautiful.
It's been my failures and my mistakes along the way that have led to the most growth.
Yeah. What a beautiful message. Thank you so much for sharing your story. What an incredible journey you've been on, and what strength you have making it through all of this. And here you are, this shining bright light in the world. And I just can't even imagine everything you're going to create from here on forth. It's such a blessing that we have met. And thank you for your time here.
It's a blessing. Thank you.
Thank you so much for tuning into the Wake Up Protocol. If you like what you heard, share this episode with 3 people who need to hear this message. And if you want to go deeper, head to thewakeuprotocol.com and sign up for our email list. That's where we share behind the scenes insights, bonus resources, exclusive invites, and the kind of guidance we only send to our community. And if this is the last thing you hear from us, all we'd like to say is keep going, trust yourself, follow your heart. Until next time, have a safe and happy journey.